Hi everyone, and welcome back to IB Psych Revision. Today we are looking at .point 5.7, which is examine approaches to treatment, and today we're looking specifically at individual treatment. So this is part 2 of .point 5.7. As we have done for all the others, we're going to describe it, provide a rationale for the treatment, describe some benefits, and there is a lot of content for this, but that does not mean that you need to know all of this content. We're just going to be going through a couple of things that might be pertinent, and obviously you can choose what is relevant for you or what you will remember the most. So let's get started. What is individual treatment? Firstly, it is psychotherapy or psychological therapy received by an individual one-on-one with a therapist, as opposed to with someone else like a family member, a partner, or a group. So why do people implement this kind of treatment? Well, it assumes, so this is a key term as we are looking at the assumptions and interrelationships of the issue. It assumes that a person's difficulty or disorder results from unhelpful behavioural and cognitive patterns. So those are two things that we are going to be looking at in depth, put together as CBT, cognitive behavioural therapy. It also focuses on changing an individual's beliefs, attitudes, and expectations that are creating negative or maladaptive, as in harmful, emotions. One of the big benefits that exists for individual therapy over group therapy is that it's a lot more personalized, which means that your voice won't get lost amongst others, and you know that you are truly being catered to instead of a group. Okay, so there are three kinds of individual therapies, and those are psychoanalysis, so that's a bit of Freud, cognitive therapies, and behavioral treatments. And cognitive and behavioral treatments are often combined. That's quite important. And here we have a couple of behavioral techniques that have been used, and those are based on classical and operant conditioning. So by no means do you need to know all of these, but I would suggest that you pick one that you will remember. So the one that I really like, well, the one that I prefer is the first one, which is systematic desensitization. So remember, this is a behavioral technique, and basically what it is counter conditioning. So you associate a feared object with an incompatible response, usually relaxation, and this is done step by step according to a fear hierarchy. So what that means is that a person comes in with a fear or a phobia, and instead of just confronting them with the feared object straight away, they build up to it. So maybe first they get them to read the word on a page or see a picture of it, and step by step they build up, and they don't progress to the next stage until the person feels relaxed doing the previous stage. So this is based on the assumption, again keyword, that fear and relaxation cannot exist at the same time. Though it may be that mere exposure is enough to reduce the phobia, this is considered more ethical and patient-directed, as treatment only progresses when the patient feels comfortable to do so. So I really like this one because it's really considerate of how the patient might be feeling, instead of just pushing them straight into a feared situation. And you would probably like to include the researcher here, and it is Wolk. Again, there are a number of others which we won't be going through, but you can have a look at those on your own. Okay, so let's look at some cognitive techniques. So what is this based on the assumption of? The assumption that people's thoughts and feelings can influence their behavior, and really focuses on identifying which of those beliefs are causing distress. Obviously, not all of your beliefs will be causing you distress. Which are the ones that are really maladaptive or really harmful? And importantly, it focuses on current issues rather than past issues, which we will see Freudian techniques are very much focused on childhood. And then the client is required to examine these thoughts for rational basis. So I want to go through two because I think two are quite good. And the first one is Ellis's rational emotive behavior therapy. And basically it is an A, B, C, D thing. So that should be quite easy to remember. What happens is an A, or an adversity or activating event, triggers but does not cause a highly emotional C, which is a consequence. Rather, the cause of the emotional consequence is the person's B, or belief systems. That goes back to the assumption that their thoughts are the ones that are influencing their behavior rather than the events that happened. And this is countered by a D, a dispute belief system. And this kind of therapy is effective in self-demanding or perfectionist people. However, it is ineffective in those with psychotic or schizophrenic disorders, as these people cannot usually engage in talking therapy in a meaningful way. The second one that's really good and recurs in many dot points is Beck's cognitive restructuring therapy. And as we know, Beck is all about the negative triad, so negative thoughts about the self, about others, and about the environment. And basically what we do in the therapy, we identify those thoughts and then we reconstruct them to be more positive and useful. It is not only effective in treating depression, which was its original purpose, but also phobias, anxiety disorders, and eating disorders. And is also less confrontational than Ellis's approach, which might put off patients, and that would seriously be detrimental to their treatment. Okay, so there are two more. Those are there for you to look at. Thirdly, we're going to be looking at psychoanalysis. So what is psychoanalysis? Psychoanalysis is basically very classical Freudian psychology, and it is based on the assumption, important word, that people's distress results from unconscious conflicts and defenses. So these things are not necessarily able to be measured or able to prove that they even exist. But what we want to do in this therapy is conduct an intensive analysis into the client's past, which is different to current therapies, which really focus on the present. And these unconscious thoughts will reveal insights into how their disorder came about. And then talking about it will be emotional release for them, which will ease their symptoms. And the goal is not understanding, the goal is understanding, not change. And this kind of therapy can last for months or years, and it's often several times a week, and you may not even get to your presenting symptom for a couple of years. So it basically includes two main things, and that is the free association. So basically all you have to do is ask the client to talk freely about their dreams, their memories, and their fantasies. And then transference. So the client transfers unconscious emotions or reactions onto the therapist. The therapist doesn't have a very active role in psychoanalysis. They're mainly there as a kind of sounding board, but they don't really say much. Okay, so how effective are these individual treatments? So for ease, I have combined cognitive and behavioral techniques in one, as they are often done in real life anyway. And cognitive therapy is most effective in depression, and you're less likely to relapse than if treated on drugs alone, which is um, noted by Seligman. And probably the reason for this is that these kind of therapies will teach you coping strategies instead of merely addressing the somatic symptoms. There are lots of other studies that you might like to include. The one that I like to bring up as a counterpoint is that CBT does not work so well in people with entrenched personality disorders or unwillingness to engage in therapy. And that's a major hurdle. It really is. So that was noted by Brody, and as I said, I would include that as a counterpoint to Seligman. What about psychoanalysis? It's very difficult to measure because how do you measure unconscious changes? So yeah, it's very abstract. Um, Also, it takes forever. So by the time that you get around to feeling better, that might have occurred naturally instead of as a result of therapy. Um, Meta-analysis show it is more effective than no treatment, which is by Smith, being most effective in those with less severe problems, like such as minor neuroses and anxiety disorders. And that was noted by Sloan. What is interesting is that it is most effective in Yavis, so that means young, articulate, verbal, intelligent, and successful people experiencing mild depression, anxiety disorders, or interpersonal problems. So uh, it actually appears that they have quite a good base level to start with. So for me, that doesn't really recommend it as a super effective treatment, and it's not really used that much today anyway. So that was quite a long talk point. Apologize for that, but thank you for listening and see you next time.